Hello. Welcome to animatedteeth.com and our page that discusses what to do if you have a dental crown come off. For starters, we'll mention that while not the norm, losing a crown isn't necessarily all that uncommon. And the good news is that in many cases the lost crown can just be recemented back on, typically with the expectation that its long-term outlook will be fine. That of course applies to situations where there are no complicating factors, such as the presence of tooth decay or concurrent tooth breakage. These are things your dentist can easily check for. So, with your crown in hand, what can you do to help ensure that it can be recemented? Well, a very important issue to understand is that teeth that aren't locked in place by their contact with neighboring and opposing teeth will have a tendency to shift. So, in the case where a tooth has lost its crown, clearly its exposed nub won't be in contact with any other teeth at all. And actually, any teeth that touched or bit against the missing crown will have the potential to shift too. And here's the rub: if any of these teeth shift significantly enough, your crown will no longer fit your tooth's space correctly and your dentist will need to make you a new one. So, what's the solution? What do you need to do if you've had a crown come off? Well, as an initial step, you need to contact your dentist's office and advise them of your situation. They can then appoint you as promptly as possible so you can be evaluated and hopefully have your crown cemented back on. But sometimes circumstances dictate that immediate assistance can't be arranged. So, what steps can you take in the meantime so things don't go awry? The simple solution is to just wear your crown. When back on your tooth, the crown will make appropriate contact with all neighboring and opposing teeth, making it impossible for any of them to shift. So, how do you do that? And what precautions are involved? If both the inside of a crown and the nub of a tooth it fits over are free of debris, a person will usually find that their lost restoration can be slipped back onto their tooth. And if 100% in place, when they close their teeth together, everything about their bite will feel 100% normal. So, give that a try. Gently clean your tooth and crown, like with a toothbrush and rinsing. Then slip your crown on. If that feels okay and normal, then very gently, just as the lightest test, close your teeth together. As you do, if anything seems amiss at all, back off immediately and take the crown back off. But in most cases, the crown will have seated properly. And when you close your teeth together, 100% of things will feel normal and right. If they don't, you can check again for any debris that's keeping your crown from fully seating on your tooth and then try again. But if the seated crown still doesn't feel 100% normal, take it back out. And in this case, the set of instructions we outline in this video isn't going to work for your situation. Assuming that all went well, what should you do next? Well, no one really knows how quickly your teeth may shift while your crown is off. And we'll point out that from the standpoint of appearance and possibly comfort, for example, some tooth nubs are sensitive to air, or hot and cold, you may want to wear your crown more often as opposed to less. So, what makes a good plan? In most situations, wearing your crown at least several hours per day is usually enough to ensure that no significant tooth shifting will take place. So, a plan could be to wear your loose crown during several of your waking hours, like times when you don't have to talk, aren't eating or drinking, and can just keep your teeth together to ensure that your crown stays in place. And by the way, you would keep up this routine each day until you finally get in to see your dentist. For times when you can't meet those conditions, the risk of your crown coming off unexpectedly and causing consequences, like getting bitten on or swallowed, rises. So, you'll need to experiment a little, weigh your risks, and take your crown out when higher levels of risk prevail. As an aid in wearing your crown more securely, our page explains how denture adhesive or Vaseline can be used as temporary cement that can make it harder for your crown to be dislodged. It would never be expected that these aids would anchor your crown well enough for eating, drinking, or sleeping. And even talking or just wearing your crown for appearance's sake might be iffy. Only you can decide how secure things seem to be, and if that level of risk is worth the reward. You can purchase stronger kinds of temporary cement in the dental section of your local pharmacy. However, we wouldn't recommend the use of this kind of product without getting your dentist's blessing first. Some of them aren't compatible with the kind of permanent cement that they will use. Also, these cements usually set hard, meaning you either get things exactly right the first time, especially in regard to your bite, or else you've failed, possibly leading to complications. As another mention, expect that super gluing your crown back on your tooth will end up being a world's worst decision. Repeat, do not do this. As far as how much you need to wear your crown each day, here's a guideline. If seating your crown on your tooth always seems to be the same passive fit, you're probably wearing it enough. If instead sometimes you need to force it on a little or it feels wedged in place, well, that's a sign that your teeth have shifted some and you need to wear your crown more. As far as what to do when eating and drinking, just take your crown out. And make sure to avoid chewing things in the area where the crown's space is, so its tooth nub doesn't get damaged. So, with those instructions and precautions, we'll wrap this video up. Our page contains additional important information, so be sure to give it a read. And after you do, run your interpretation of our instructions past your dentist so they can give an okay to your plan. Good luck. Your efforts should pay off. Goodbye.